A few months ago, I started to hear voices. Sometimes they just whisper things. Sometimes they yell. They tell me about my friends. I can't go to class anymore. My teachers are evil. Lunch was terrible. Something is always watching me.
Today on True Life, we're taking a look into the story of John Forbes, a 21-year-old college student that has been diagnosed with schizophrenia. His struggle to hold grips with reality has made school, friendships, and day-to-day life difficult. The first steps to John's diagnosis was from his friends, who started to notice that his behavior was becoming more and more unusual as the year went on. Concern grew when John began smoking, something he'd always been adamantly opposed to, and he started to fail classes.
John has been literally my best friend in college. There probably isn't even anyone that's in contention to how close we were. But in the last 6 months, he's just been acting really weird. He gets really distracted when we talk, and it almost seems like he's having a conversation with someone else. Lately, he hasn't even been returning my calls or hanging out with me at all. The one time I saw him on the mall, he totally avoided me and looked at me like I had horns coming out of my head or something. I just feel like something must be really wrong. I just want my friend back.
After extensive urging by his friends and family, John was finally convinced to go see a psychiatrist, Dr. Pepper. This is a look at their first session.
Hi John, I'm Dr. Pepper. Nice to meet you.
John,
How are you doing today?
fine.
Good. So your parents tell me you go to Creighton. What's your major?
Business.
Business? Okay. Anything specific in business or?
Numbers, math, accounting,
Alright.
calculating, writing, listening, watching, thinking, counting.
Okay then. That's great to hear. I hope it works out for you. Do you know why you're here today, John?
I think so.
You think so? Why do you think you're here?
I don't. I don't want to say.
Well, it's okay. You can talk to me. Anything you say in here is confidential, so.
Because my parents are worried about the voices.
What voices are they talking about?
Voices.
The voices? Okay. Well, what do these voices tell you to do?
Tell me to do things.
What kind of things exactly?
Tell me not to leave the dorm. I can't leave. I can't leave.
So that means not going to class then, or communicating with anybody else?
No. No, no, no.
No?
No, I can't do that.
Why do they tell you to do this, John?
I don't know. They just do.
Well, there has to be a reason why they're telling you this, though.
Because everyone's lying to me
Everyone's lying to you? What are they lying to you about?
about who they are.
Well, if they aren't who they say they are, then who do you think they are?
They're aliens from Saturn.
Do you really believe that, John?
Of course I believe that.
But why? What makes you believe that?
They tell me. They tell me, and they're always seeing and watching and telling me things.
After our session, I decided that it would be a good idea to begin treatment immediately for John. While there are some risks with going ahead with medication, it is a necessary step to seeing improvement. I prescribed John 2 milligrams of risperidol a day, which is a medication that works as an antagonist for both serotonin and dopamine receptors, although more strongly on the serotonin receptors. While risperidol does not cure schizophrenia, it has been a proven treatment for many of the symptoms. It has side effects of its own, but they affect people on an individual basis, so we will see how John reacts. It is possible that he might have to stay on medications his entire life, but not definite. A lot of the way these medications affect patients in the short run and long run is still kind of unclear, with a lot of research pointing to schizophrenia requiring lifelong treatment. But some new information coming has shown that patients who complete treatment and stop using antipsychotics are less likely to be exhibiting psychotic symptoms 5 years later than people who have been taking the medication continuously. Obviously, it is difficult to gauge exactly how these things will affect people, and information changes as the medications age and new data comes in. Aside from the pharmaceutical therapy, I also assigned John some behavioral therapy just to help him learn what is an appropriate way to engage in conversation, especially to help him better understand how to interact with fellow students and teachers. Also, I advised his parents and brother to join a support group so they can better understand how to deal with the issues John is going through and how to support him as well. We'll see how John takes to treatment and follow up later. Hopefully things should be a lot better and his psychotic symptoms should slow down fairly rapidly over the next few weeks. Fingers crossed.
Hey MTV, I've been on risperidol for a couple months now. I sometimes still hear things in my head, but it feels quieter now. The whole world has slowed down a lot. I've gained almost 15 pounds since I... Shut up! Hey MTV, I've been on risperidol for a couple months now. Sometimes I still hear things, but my head feels a lot quieter. The whole world slowed down a lot. I've gained almost 15 pounds since I started risperidol. I've had to go to the doctor a lot to keep my metabolism in check. I see Dr. Pepper every week. She talks to me about the things I hear. What?
Just Dr. Pepper.
I'm still not sure about her. She seems nice enough, but you can never tell. Never can tell. She's telling me the things I say don't make sense. If I just think about it, I know they couldn't be true. My family's been a lot nicer to me lately. I think I don't scare them so much anymore. I was kicked out of school because I missed too many classes and I had to stay home. College was a scam anyways though. They just take your money and take your money and take your money, and then your professors can't keep failing you, even when you know everything. Anyways, hopefully things are getting better. Quiet's nice. I still don't know what to think about things, but hopefully it stays quiet. Thanks.
I feel like going to Dr. Pepper has really done a lot for John. Things aren't the same as they were before, but the medications really seem to bring him some peace. I'm just glad that he got treatment, and now we can understand what's going on for John and make his life a little less complicated than it already is.